Hey everyone, this is Josh with Nurse Cranham, and in this video, we're breaking down a high-yield NCLEX style question on insulin administration, one of the most tested topics in NCLEX pharmacology. We'll walk you through each answer choice, and I'll point out what to focus on during the exam so you can apply this knowledge when it counts. So let's dive in. A nurse is educating a client with type 2 diabetes about insulin therapy. The question is, which statements by the client indicate a correct understanding of insulin administration and management? Select all that apply. So for statement one, it says, I will rotate injection sites within the same area to prevent tissue damage. This is correct. On the NCLEX, they're checking if you know that rotation within the same body region, like different spots on the abdomen, is the safest way to prevent complications like lipodystrophy without affecting absorption. If the option says rotate sites, don't just assume it's right. Look for how it's rotated. Rotation across different body regions like leg one day, arm the next, creates inconsistent absorption. That's what you want to avoid. Statement 2 says I should administer insulin glargine before meals because it works quickly to lower my blood sugar. This is incorrect. Glargine is a long-acting insulin. It does not peak and has no connection to meals. Watch for distractors like works quickly. That wording might make you think of short-acting or rapid-acting insulin. NCLEX likes to trip students up by mixing up insulin types with timing. Know which insulin types correspond to meals and which do not. Statement 3 says if I experience shakiness and sweating, I should check my blood sugar immediately. This is correct. Immediate blood glucose monitoring is the priority. When the patient has symptoms that could indicate a critical imbalance, like low blood sugar, the NCLEX wants to see that you assess first, then treat. Check blood sugar is assessment. That's what makes this answer correct. Statement 4 says, I will store my unopened insulin vials in a refrigerator. This is also correct. This is standard medication safety. Storage questions show up to test your understanding of safe handling. NCLEX doesn't expect you to memorize manufacturer instructions. They just want to make sure you're not doing something dangerous like freezing insulin or storing it at the wrong temperature. Statement 5 says it's okay to mix rapid-acting insulin with NPH insulin in the same syringe. This is correct. Yes, if done properly, and NCLEX expects you to know the order. Anytime insulin mixing shows up, remember, clear before cloudy. Regular insulin first, then NPH. If the question mentions mixing, but the draw-up order is wrong or not mentioned, it may be a trap. Statement 6 says if I miss an insulin dose, I can take double the dose at the next injection time. This is incorrect. This is unsafe and should trigger red flags. Never choose an answer that suggests doubling a dose, especially for a high-alert med like insulin. NCLEX often tests safety by offering options that sound logical but break protocol, but for anything that increases risk and eliminate it. So for a quick recap, the correct answers are rotate sites within the same area, check blood sugar when symptoms of hypoglycemia occur, store ARNP and insulin in the fridge, and mix rapid-acting and NPH following proper order. So thanks for reviewing this question with me. If you're preparing for the NCLEX, remember this. Pharmacology questions are often testing your ability to prioritize safety, not just memorize facts. So always ask yourself, does this action support patient safety? That mindset will guide you toward the right answers. Keep practicing. You've got this.